Welcome to this module. Before we talk about how to fix neck, upper back, shoulder, and arm pain, it's important to understand what's actually happening in your own body. Neck, upper back, or arm pain that comes from an irritated nerve is medically called cervical radiculopathy. Cervical refers to the neck, and radiculopathy means irritation or dysfunction of a nerve root. In simple terms, this means a nerve in your neck is irritated and causing symptoms elsewhere. One important thing I want you to know right away is just how common this actually is. In my clinical practice, neck-related nerve pain makes up a significant portion of my caseload, easily a quarter or more of people I see on a regular basis. You are not dealing with something rare or unusual, and you're certainly not alone in this. The reason that's important is because conditions that are common are also well understood, and in most cases, they respond very well to the right treatment approach. In the spine, we have bones called vertebrae, cushions between them called discs, small openings where nerves exit the spinal cord and travel out to the shoulder, arm, and hand. These nerves control sensation and muscle function. With cervical radiculopathy, one of these nerves becomes irritated as it exits the spine. That irritation is what can lead to pain, numbness, tingling, weakness, or burning sensations in the neck, upper back, shoulder, arm, or hand. Cervical radiculopathy can occur at different levels of the neck, which is why symptoms can look very different from person to person. It most commonly affects the C6 or C7 levels, but it can also involve C5 or C8. Knowing which level is involved can help explain your specific symptoms and help determine the most appropriate exercise approach, which we'll cover in later lessons. Common causes of nerve irritation in the neck include disc bulges or herniations, narrowing around the nerves called stenosis, arthritis, small spinal shifts, or even movement and muscle imbalances over time. While these conditions sound different, they all share one thing in common. They can irritate a nerve in the neck. This irritation can develop after a single injury, from repeated strain or posture over time, or is even part of a normal age-related change in the spine. A question I'm often asked is whether a nerve can be pinched outside of the neck, such as in the shoulder, upper back, or arm. While that can happen in some cases, the vast majority of nerve-related arm symptoms actually start in the neck, even if you don't currently feel much neck pain. It's important to work with a healthcare professional to accurately identify what's contributing to your symptoms. The good news is that for most people, this is not a dangerous condition, and it does not mean your spine is fragile or permanently damaged. Although the symptoms can be uncomfortable or even scary, they are often manageable and reversible with the right plan. Once the cause is understood, there are safe and effective things you can do at home to reduce pain, improve movement, and prevent future flare-ups. In the next video, we'll go over the most common signs and symptom patterns of irritated nerves in the neck so you can better understand what's happening in your own body and recognize your unique presentation.